discuss, educate, and analyze about issues that are affecting our girl child, and we try to table down possible solutions to make sure that these problems are solved in our society. Today I have with me Dr. Bittaye. Dr. Mustafa Bittaye is a gynecologist at Edward Francis Small Teaching Hospital, and we will be talking about urinary tract infections. Urinary tract infections is one of the infections that affect most young girls, and one of the problems they have is how to go and see a doctor to make sure that that is solved. So Dr. Bittaye is going to break it down for us and make us understand what is urinary tract infections and what is supposed to be done when a girl is affected by this. Dr. Bittaye, welcome to the show.
Yeah, thank you very much.
So like I said, Dr. Bittaye, just tell us an overview of what urinary tract infections is all about.
Oh, thank you very much once again for the invitation. And I think it's an important topic that we need to, highlight a lot in the society. So urinary tract infection, like you mentioned earlier, it's a very important issue to women. And you see my background is mainly women, but it affects also males, and it affects young and the elderly. But it's very common. If you compare males to females, it's commoner in females compared to males. There are other conditions that will make it also, come like if you have diabetes or other problems, or some outlet problems. You can be predisposed to urinary tract infection. But it's a burden that we have, especially premenopausal women have. And I think it's good that we tackle it. But if you look at the name, urinary tract infection, it's sort of a misnomer. Many people will think that probably it's just the urethra, it doesn't include the bladder and all that. But generally, you can say it just involves the urinary system, from how it is produced, the urine, from the kidneys, the ureters, the bladder, to the urethra. Any inflammation around there, secondary to bacterial infection, we can call it urinary tract infection.
So what are the different types of urinary tract infections?
Yeah, so if it affects, for example, the bladder alone, we call it cystitis. Okay. If it affects the urethra alone, urethritis. But generally, it's usually a continuum, because the bacteria is already in the medium in the urine, and it can affect the whole length. But if it is specifically only in the bladder, you can call it cystitis, urethritis, pyelonephritis if it is up in the kidneys.
So most times we're told that UTIs are caused by using public toilets or so. That's the general view that everybody have. But can you tell us in a medical view, what causes UTIs?
This behavioral, I think it's good that you're bringing this up. They are called the behavior. There's a study done which looked at these behaviors that people do, whether it affects their outcome, the recurrence of urinary tract infection. And it's a common advice that health personnel give. For example, one of them is that in Gambia, what is common is that the way women clean themselves. The urethra for the female is short. For the man, it's about 25 centimeters. For the woman, it's about 4 centimeters. It's very short. So you have the urethra, then you have the bladder. And for women, the urethra, it opens up in the vestibule, that is in the vulva, around the vulva area. And that's very close to the anal area. And the stool usually has a lot of bacteria, E. coli and all that. So the proximity between the anal area and the urethra of the woman, plus the urethra of the woman is short. So all these things people believe predispose to urinary tract infection. So if a woman cleans herself, they say from backwards coming upwards, like if you're cleaning yourself after passing stool and all that. So it is believed that you might introduce some bacteria, because bacteria is so small, you cannot see it. It's so tiny. So the mere fact that you clean upwards, maybe you introduce the bacteria to the area and all that. Yes. But some studies have been done, and really they did not corroborate that. Yeah, but this is a common thing that it makes sense, and we all believe that women have the disease more than the men, and
so the signs, I'm more particular also about the signs and the symptoms, because some women are actually affected by UTIs, but they don't know. They just think it's a change of menstrual, whatever. I don't know. That is some of the queries I hear in town. So what are the common symptoms and signs of UTIs that you're affected?
Okay, because it affects that area, so the woman may complain of burning sensation around there. and especially when they are passing urine, you know, they may have some burning sensation. So the other thing that they may have, if it is around they may have suprapubic pain. That's the lower abdomen, below the umbilicus. Yeah. They may have pain there, feel pain, you know. And some of them will pass urine all the time. You know, some other symptoms can cause that. We call it frequency. Like a woman will come, go pee small, come back, pee small, pee small.
At
so
every interval.
Yeah, you on very short intervals, you just go and pee, and not much will come because there's irritation around the bladder and all. And sometimes also the body can be warm. You know, they may have constitutional symptoms, the temperature of the body is high. And sometimes they can have, if it is serious, they can have vomiting and all that. And some can have
back pains.
Yeah, pain here.
Okay,
we call it renal angle, loin here. The loin, yeah, the loin, just at the back.
Okay.
Yeah, they can have severe pain there. Yeah, so that's why if they go to the hospital, you see sometimes the doctor beating that side to see, because it can be pain. Yeah, if it reaches, if the urinary tract has gone high up, you may have pain at the loins and all. So some of them will have severe vomiting and will need admission if they reach that level.
Okay. Yeah. So what about the cure? What are mostly, maybe, I don't know, maybe we should not tell them out there the cures of UTIs before they go and start doing it on their own.
No, it's okay. I think it's good.
So what are some of the cures of urinary tract infection?
Yeah, I think it's good we give them all the information and they know what options, because nowadays we as doctors, we always find that. So when patients come, they've already read, and it's good, it makes the discussion easier because they've already read about this drug is not good, this drug is good.
Yeah,
so and they come and ask
on
you.
Google especially, you see all those things.
So it's good. So now when you tell them, you just convince them easily to use it. But you see, what the danger is that if patients don't know, and they don't research, they don't have the background, you can just prescribe for them, but they will not use it. So there won't be compliance. Wow. Yeah, that's the problem. You may prescribe your drug, everything. They go because they will not use it, so they will not get better. But when someone who engages you, the one who engages the doctor, talks too much, asks a lot of questions. Yeah, so that one is good because when they do that, then when they leave the place satisfied, knowing that they've known all the doubts have been cleared, and also if they go, they will take the drug and they'll get better. So
do we have doctors that are resistant about, I don't know, maybe answering so much questions that patients have to ask?
I think doctors are usually happy
when that patients so much.
Yeah, so I think just that sometimes the queue outside is too long and other patients are angry. No, you have to. When somebody comes with their doubt, you have to clear it. Sure. But the problem is that the others outside make a lot of noise and say, you wasted so much time inside, why do you do that? They may attack the other patient, and because of that, some of them will not want to voice out all their questions. But it's important we talk about it here. Yeah. So the treatment we have, usually when they come, we'll do examination also after taking the history. You know, the history is what they will tell us. They have burning sensation, they have days and all that. Then we examine them. So when we examine, we'll see whether it's, sometimes what they think is UTI might be actually STI. It's different. It's different if it is
sexual transmitted infection.
Yes,
it's different.
It's totally different from UTI because the places that are affected are different. Yeah, so, but most of the time they can happen together and all that. No. Yeah, so, but now when we examine them, we'll be able to know, you know, what is happening, where's the pain and all. Then we can do some tests to confirm. Because thank God, the urine is accessible. And it's, you don't have to put a needle or something to get it. So you just give them a pot, take a midstream urine, they pass urine after, then they have a clean catch. Okay. Then you cover it, you take it quickly to the lab, then we review it. So if we look at the urine, and we have some tests we can do, we can see whether the bacteria is there or not. And we can also allow the bacteria, if it is there, to grow, so that we test the antibiotics.
To know exactly what bacteria is present.
Yeah, what bacteria is present and which antibiotic can kill it. Okay. Yeah, we can do that. We call it culture. You culture the bacteria and put some antibiotics around it and see which one will kill it more. Then you can prescribe that drug if it is safe. So we do those tests. Then after that, we guide the treatment. But that result sometimes takes 3 days. So before we get the result, we put you on empirical treatment. We put you on a treatment that we've been using, and has been helping us. Okay. We call it the first line. And if that one comes out and it shows that it's not sensitive to this one or it's sensitive to another one, then we can change to the right one. So the treatment is not blind. Okay. So it's guided by the laboratory.
That's really interesting. Yeah. It's like I want to be a doctor already.
Oh, nice.
So the home remedies, because most times, like I said, girls are actually very shy to go and see a doctor. So the home directory is Google. They Google to know exactly what they're supposed to do and how to save themselves, which is not advisable, obviously. But what are some of the home remedies? Are there any home remedies in solving UTIs?
Yeah, so it's good. I think we should encourage them to Google. You know, they can Google search.
Okay.
I think that's okay. But the antibiotics, you can't go and buy it. It has to be prescribed.
It has to be prescribed.
Yeah. So, and before it is prescribed, we need to check a lot of things. So the antibiotic is not just, because some of them, you know, maybe if you are pregnant, you should not take it, or some other restrictions, or you are on other drugs that will not make it work. You know, so it's good that a doctor give it to you, and doctor will consult and look at other reference and ensure that it's safe for you. So the women out there should not go and just take antibiotics like that. Even if they have access to it, don't take it. First see a doctor to see, because sometimes you are taking another drug which will make this drug not potent.
Oh, wow.
Yeah, yes, it happens.
It happens?
Especially with some of the family planning drugs you are taking.
Oh my God.
So you have to be careful before you take the antibiotics. You talk to the doctor. And then, yeah, but the home remedies, like I said, some of these studies have not corroborated this, but generally they advise that if you take a lot of water, because it keeps cleansing the area, it may help. I mean, the evidence is not so strong, really. And the other thing is cranberry juice. Some people talk about it.
Cranberry juice.
Yeah, because some studies have shown that cranberry juice can inhibit E. coli from attaching on the wall, but not strong evidence to show that it can help reduce UTI.
Wow.
No, but you know, people just use it to see.
That it works.
Yeah, because it helps to reduce the adherence of the E. coli on the wall.
They also talk about natural yogurt. I don't know.
I'm not come across that. Yes,
yeah,
yes,
I think I've heard
yeah. But you know, you can see in the
natural
net a lot of things which may not.